specific condition, you guys have to study. But the study part is something that you guys have to do on your own, right? So I'll go through the guidelines. I'll tell you that the guidelines are important. Some important things we can discuss. What could be asked? What could be the questions? But the thing is that main reading part is going to be your effort, right? So don't mind if I go through things a bit quickly. Okay, so like is like a sample summary. Today I got a chance to speak to John, who is a 16-year-old boy, and presented with a severe exhibition of asthma during playing football. He was managed in ER with nebulization and IV medication and has improved now. This is his third exacerbation in the last 2 months. So like you need to know that like recently how many admissions are there. He was diagnosed at the age of 7 years, but he does not remember much details. He had frequent episodes of wheezing for which he was evaluated and started on the inhalers. Currently, he's on the follow-up of the specialist and the asthma nurse and is taking SABA and the steroid inhaler. He has poor compliance as he often misses his steroid inhaler because he forgets taking it before going to the school. He also feels upset about the restrictions that he has to face due to his illness. As his asthma worsens on extra physical activity, he has to be careful about the sports and has to wear mask, which makes him feel awkward. He also has mild eczema for which he used topical emollients. He has multiple admissions in the hospital. The last one was 3 weeks back. He has no drug or the food allergies and is immunized. He's studying in class 9 and has issues with peers as he does not have a lot of friends. He lives with his mother, who has a history of asthma as well. They have recently moved to a new house. So this, like there's a bit of a change in this one because it, like obviously when you say so they recently moved to a new house or like living in an old house with no pets at home. He doesn't have any idea about how to be about the care to be taken at home to avoid triggers. The family is facing issues that the father left them and there are financial concerns. The disease has a significant impact on John and his mother as well, right? So this is like a sample thing the way you can do. So for an acute event, just for a revision, that when we take history of an acute event, you need to know what happened before the event. You have to find the trigger specifically for that, in which in this one that you've mentioned that increased physical activity or the weather could have been the reason. What happened during the event, details to find out about the severity of the attack, including the breathlessness, color changes, was he able to speak? So you did ask all of that. After the event, what medicine you take? You did ask about the inhalers and the management in the ambulance and the hospitals. So important questions in any of the allergic cases we discussed previously as well: allergic rhinitis, runny nose, atopic eczema, itchy skin, the allergies of the foods and the drugs, and then a quick systematic review. Past history, age of onset, diagnosis, how was it diagnosed, the number of hospitalization, the worst admissions, investigations, treatment required, number of steroid courses in the last year. That's an important question as well. Changes in the clinical course, complications, any of the ICU admissions, and the peak flow diary is kept or not. That's really important. Then regarding the triggers, you know that the asthma, it could be triggered with the viral upper respiratory tract infections in the environment, tobacco smoke, indoor wood fires, bush fires, like gas heaters, weather, pollution, temperature change, humidity, cold, dry air is a very, very common trigger. Then exercise, any of the animals, any of the foods, at times some of the emotions like laughter, stress, these could happen as well. And certain drugs could be like perfumes, aerosols, anti-NSAIDs. They could aggravate the asthma as well. So for the management part, what usual treatment are they taking at home? Inhaler, is it with a spacer? How is the compliance? What are the side effects of the steroids if they haven't taken very regularly? What teams they are following? Any other of the alternate therapy has been advised or not? Because you know then when if the asthma is not being managed on just the steroids, we could add a few other things. Um, and then allergen avoidance. Do they have an idea about that? Management, what dietary, if there are any dietary restrictions and dietary manipulation, do they have an emergency ID bracelets or the crisis plan? That's important as well. Home monitoring, P flow diary. Has the child got to demonstrate like do they know that the technique, like are they in contact with the nurse or not, and have they got the proper training about that or not? Then what is if the you are taking history from the parents? What's their understanding about the inhalers? Then about the development, depending upon the age of the child, family, immunization, nutrition, drugs, social, all of these. In the social, the disease impact on the child, school missed activities, behaviors, peer interactions, on the family, the financial issues, the nebulizers, peak flow meters, frequent hospitalizations, insurances, routine issues, then any of the support, any of the local groups that the child is a part of, and any of the like impact on the siblings. Journal management that you have to tell is basically about the parents and the patient education, the avoidance of the allergen, minimize pollutants, dietary inclusion of vitamin C and E, physical exercise, smoking cessation, and the support groups. So I've like this is from the recent guidelines. I know it's a very populated slide. Maybe you guys can open it from your own guidelines. So a few changes that I could find in the asthma guidelines. If you guys can open them on your, let me see. I'll open that on my screen. Um, Let me just open the guidelines so we can quickly go through them and have an idea. So one thing that you have to keep in your mind is that there are two different management parts of uh, the guidelines. Sorry, the asthma management. Are the guidelines visible now?
Yes, doctor, there are.
Okay. So you can see that the signs and symptoms, all of these are there that have been here. So acute asthma management, they've mentioned the definition, the signs and symptoms, then the severity. So one thing that has been changed is that previously in the previous guidelines, this age here was like less than 5, 5 to 12, and then more than like 12, 12 to 18. Here they've said 5 to 11, and then 12 to 18. So this is a like bit of a change here. And then this how they have categorized and the differential diagnosis, assessment, immediate management. So yeah, so management they have included some important things here. Previously this first line, second line, and the third line, these things were not mentioned in this way. So you have said that when the child is like not responding, then you have to discuss with the on-call consultant. And the oxygen, they have maintained that you have to maintain the oxygen between 94 to 98. IV line first is the magnesium sulfate, and specifically it's mentioned that you have to have a close monitoring of the blood pressure with the cardiac monitoring whenever you give the magnesium. So when the child is not improving with not responding within the 15 minutes of completing the magnesium sulfate, you move to the second line treatment. So the second line initial, either you give the bolus of the salbutamol IV, and then they've told this method. You don't really have to remember the exact doses or this like how you will make the preparations and everything, because that's not your thing to do. That could always be done with looking at the drug charts. Or the second line, it also includes the minophylline. So previously this was not being included. So now my IV minophylline loading dose followed by the maintenance infusion. And if the child is on the regular theophylline, then do not give the loading dose and send sample for the minophylline levels, right? So this thing was not in the previous guidelines. So this is a new thing. And then they've mentioned about they've written about this loading dose and maintenance dose, and then they've written the third line as well. So if the third line, like after the salbutamol bolus and this IV aminophylline, the things are not improving, then you will go towards the salbutamol infusion, and then the further things that, and then along with the, obviously you will continue with the oxygen and the continuous orbital nebulizers while waiting for the infusion to be started, right? So this is how so the thing is that this is not just for the HT stations. You can have a clinical station in which there's like a mild VZ child is there and you would be asked about asthma. Or a very important thing is in the video stations, very commonly coming video of in which the asthma child is given, and you have to tell about how to manage that. So they can ask you about the acute management of the asthma. And then they've written the drug doses. That's not really very important because I told you that they don't specifically ask you about that. So not very important. If you can like want to skip, you can skip that. So these are all the doses. And then they have told you about the monitoring. So like on the IV bronchodilator therapy, about the heart rate, all of these things, sex, and then they've told, but specifically what do you have to do for the magnesium, salbutamol, aminophylline. Previously these things were just written in the red the charts that was there, so it was a bit difficult to read and remember. But now it's all of this is written here in this text as well. And then this like previous history, yeah, this was important what I wanted to tell, that when recovering, ask about previous episodes of VZs, similar episodes, triggering factors, seasonal variations, nocturnal cough, family history of asthma, hay fever, eczema, atopy, smokers or vapors in the family. Because you see, vaping is really common, so maybe we need to ask about the vapes as well. Mold and damps in the house, pets, or the blue things that they've written here, that's the new things that they've added. So day school because of asthma, number of courses of the prednisolone in the last year, number of salbutamol inhalers prescribed in the last year. That would tell you that what's important of asking that number of the salbutamol inhalers prescribed in 1 year.
Madam, it will show the compliance.
Yeah, the control. Because the salbutamol inhaler is not for the compliance, because that's not a regular therapy, right? So the steroid inhaler will tell you more about the compliance. The salbutamol inhaler tell you that how many times the child got something, an episode kind of thing in which he had to use the reliever therapy, which means that he's not having a maintenance. Okay, so the drug history and the review the electronic prescription issue of the preventer and the reliever if available, so that could be like in the journal guidelines. Then discharge and follow-up. So whenever you are discharging, uh, these are the conditions when you will discharge. When they understand the use of inhaler, you have to always tell about this thing, this PAP, the personalized asthma action plan, about the written weaning by the salbutamol information leaflet, signs of deterioration. And then on the discharge, they tell you that you're going to tell about the beta agonists, steroids, and all of those things, right? So the point is that these guidelines are really, really, really important, and you have to go through them. And then this chronic management they've mentioned here, and then this chart that I showed you. So it's more or less whatever has been written. This is just a summary of that, right? So it's difficult, like obviously read all of this right now, but this is more of all of those things that have been previously said. Like you can see here, it's magnesium, then there's salbutamol IV, then aminophylline, and then salbutamol infusion. So all of the things that have been written, this is just a summary.